Hi, my name is Krista Corgatelli, and today we're going to look at a research prospectus on childhood obesity. The purpose of this prospectus is to evaluate the current treatments and preventive methods to identify new techniques that will help reduce the prevalence of obesity in children. Childhood obesity is a serious preventable disease. The World Health Organization defines obesity as abnormal or excessive fat accumulation that may impair health. Additionally, the CDC defines childhood obesity as being above the 95th percentile for BMI. These definitions provide the parameters necessary for defining the cause, prevalence, and severity of childhood obesity. According to the World Health Organization, the fundamental cause of obesity is energy imbalance between calories consumed and calories expended. However, the causal factors of childhood obesity are far more varied and complex. Some of these factors include genetics, sedentary lifestyle, decreased physical activity, increased consumption of sugar-sweetened beverages, and television watching greater than 8 hours a week at age 3. All of these factors have become a global problem due to the world change that has led to the drastic increase in the prevalence of obesity in multiple cultures and nations. Once obesity was considered a high-income country problem that disproportionately affects children from low-income families. According to the MMWR report, during 2010 to 2014, the overall prevalence decreased significantly to 14.5%. A study in Texas confirmed obesogenic decrease in the youngest group of Hispanic children. Another study confirmed the stabilization of obesity of American Indian and Alaskan Native children. However, both of these studies confirm the high levels of obesity that exceeds national averages and remains higher than that of U.S. children overall. These studies demonstrate improvement in some obese populations. However, in other populations, obesity is plateauing and some is still growing. The danger in continued obesogenic growth and plateauing lies in the present and future health complications obesity causes for our youth. Given the dangers of childhood obesity, in addition to the dangers listed on this slide, the World Health Organization reports that obese children experience breathing difficulties, increased risk of fractures, hypertension, early markers of cardiovascular disease, and insulin resistance. Obesity is associated with several forms of cancer as well as several musculoskeletal disorders and has an enormous direct impact on quality of life. To date, obesity ranks third in terms of worldwide economic burden after smoking and armed violence, war, and terrorism. Obesity has also been linked to more deaths worldwide than underweight. Globally, there are more people who are obese than underweight. This occurs in every region except for the parts of sub-Saharan Africa and Asia. Finally, the CDC reported that despite recent declines in the prevalence among preschool-age children, obesity among all children is still too high. Given the extent and severe complications of childhood obesity, additional research is necessary to aid in reducing and preventing new cases of childhood obesity. The research question is displayed here, and as a personal trainer, we see a lot of people who have access to more comprehensive material online. However, people still seem to prefer the convenience of an application to an online program. This study proposes to compare in-person obesity preventions to app-based prevention. Answering these questions may shed light on the effectiveness of current obesity preventive measures and help identify practices that are most effective in the prevention of childhood obesity and will shape the way that obesity preventive measures are used and taught, and may increase successful prevention of obesity in the upcoming youth. In order to identify the most effective preventive measures for obesity at-risk youth, This research prospectus looks at the strengths and weaknesses of current treatments and preventive measures in order to identify the most effective platform for obesity prevention. Pediatric obesity is a growing problem in the United States. An estimated 16.9% of children between the ages of 2 and 19 are obese. For this research prospectus, we'll be using the CDC's definition of being above the 95th percentile for BMI, weight for height, for childhood obesity. The prevalence of childhood obesity is likely to increase when the energy imbalance is combined with specific contributing factors and are present in the child's environments. All of these factors have become global problems due to the world change that has led to drastic increase in the prevalence of obesity in multiple cultures and nations. To combat the prevalence of obesity, several studies evaluating the effectiveness of obesity treatments programs have been conducted. This research prospectus evaluated 5 research studies on the treatment of childhood obesity. They have ran from a Head Start policy and evaluating long-term treatments in specific age groups. Additionally, this research prospectus evaluated 4 recent studies on the prevention of childhood obesity. They've looked at the partnering of schools and community organizations by using a CBPR and using technology in high-need populations in random cohort studies. All these studies used in the research prospectus demonstrate the wide variety of studies that have been done in recent years. To combat the problems of new research is emerging online to provide solutions. Given the increasing popularity of internet use, its low-cost adaptability, scalability for internet strategies, we're going to look at developing this study looked at developing the first online obesity intervention tool called the OP2 project. Another online study talked about using the TXT2BFit app. Finally, smartphones are just about everywhere, and current programs can adapt to fit nutritional needs. While these online programs are convenient and can reach a wide audience with relatively little cost, compliance is still one of the greatest issues we face. Okay, so to design this study, we're going to look at the TXT2BFit study. The original study had a sample size of 250 people, and this research prospectus will be designed to add knowledge to this study, with the intent of answering the research question in the application-based platform. Is the application-based platform more effective than an in-person platform in preventing childhood and obesity in youth at at-risk youth ages from 14 to 19 years old in Idaho Falls, Idaho? As it stands, people will be randomly assigned to the same groups, and all the basic data will follow this previous study. However, the approval needs to come from NIRB, and the Belmont principles for respect for persons must be respected. All other eligibility requirements and will be the same as the original study for consistency's sake. The uniqueness of this study is its potential to cross cultures. Answering the question may shed light on the effectiveness of current obesity preventive measures and help identify the practices that are most effective in the prevention of childhood obesity. We expect that if we're able to replicate the study, we should see the same results and introduce the at-risk youth in the United States to a successful obesity platform. The threats and limits to this proposed study are the same as the original study, with an increased level of severity due to a smaller sample size. All right, thanks, and have a great day.